Chronic diseases, especially diabetes, continue to grow in prevalence and disease burden as the population of the United States expands, ages, and adopts new lifestyles. The epidemic of diabetes that has occurred in the United States is well documented. Already, nearly 1/3 of all Americans are diabetic or pre-diabetic. By 2020, the CDC predicts that 35 million Americans will have diabetes. Many of the effects of diabetes are well known, such as extreme metabolic dysfunction, ischemic vascular disease, and renal failure. But less well known is the debilitating effect that diabetes takes on patients' feet. Years of high blood glucose levels destroys the neurovasculature of the feet, leading to progressive neuropathy and peripheral vascular disease. These two elements of the diabetes syndrome lead to many complications, including foot ulcers, infections, recurrent hospitalizations, and ultimately lower limb amputations. The total cost to manage diabetic foot complications is as much as $13 billion in the United States alone. What's more, every year, nearly 80,000 Americans experience a lower limb amputation related to their diabetes. Despite these grave statistics, there is hope to prevent these debilitating problems from ever occurring. 40 to 80% of all diabetic amputations are deemed preventable if patients are provided with a mechanism for more intensive foot monitoring. Our healthcare system's focus on acute care leaves large gaps in time in which patients with diabetes are vulnerable to foot ulcer formation. The current standard of care relies upon semi-annual clinic visits and is not sufficient for the millions of patients that develop a foot ulcer or suffer an amputation between office visits. More effective daily monitoring can reverse this disturbing trend, since early intervention methods have proven effective in halting ulcer formation, promoting ulcer healing, and ultimately preventing these life-changing amputations. Early detection and early intervention are the keys to preventing diabetic foot complications. Our team has created a fully integrated platform to address this massive public health issue. The cornerstone of the Pedecare system is a flexible shoe insole that is capable of assessing high-risk areas on the plantar foot surface using clinically validated temperature detection methods. The academic literature shows that differences in surface temperature on the soles of the feet can be used as a sensitive indicator of the locations at highest risk for ulcer formation. Using this knowledge, we created our Pedecare Smart Shoe insole to monitor the temperature of the most important locations on a patient's feet in real time.
The Pedecare device is intended for use after the physician evaluates a patient and deems that they are at sufficient risk for formation of a diabetic foot ulcer. This is often around the time of onset of diabetic foot neuropathy. Diabetic foot neuropathy places the patient at risk for tissue damage, often unknowingly. The patient will receive the smart insoles and place them in any shoes that they wear on a regular basis. Since the device slips into any shoes, they can be worn with existing orthotics and easily integrate into patients' activities of daily living. This greatly aids in establishing patient compliance. At this point, the patient can carry on with their daily routines as the device automatically gathers and sends data to a HIPAA-compliant Pedecare server.
Data is transmitted between the smart insoles and a central Pedecare server over the cellular network. The device operates without the need for a smartphone or home internet connection. Since our device is designed to reach even the sickest and most difficult to reach patients, we have attempted to minimize the effort required from patients and physicians to make it effective. Once the data is received on the Pedecare server, it is analyzed using a proprietary algorithm developed by the Pedecare engineering team. Our system flags high-risk patients and then sends physicians or their staff automated alerts. Test results are presented to providers in a manner that allows for quick and easy interpretation. Physicians or their staff can then respond appropriately to the alerts, either via messages, directed phone calls, or scheduling of additional clinic visits. The Pedecare system does not add any additional burden to the already constrained schedules of the primary care physician, but on the contrary, provides an easy-to-use tool that allows physicians to enhance their workflow and the efficiency of patient encounters. Our system is also aimed at providing patients with a tool to allow them to take more active control of their chronic condition between physician visits. Patients engage with the Pedecare system through an automated text message system that sends and receives important information between the patient's phone and the Pedecare server. Patients who own a smartphone can use the Pedecare mobile app to track their foot health over time. However, no smartphone is required to use the Pedecare, since we are attempting to reach patients across all socioeconomic classes. The Pedecare ecosystem seeks to actively engage patients and physicians in order to optimize chronic care management and improve patient outcomes. The Pedecare is inexpensive to produce, easy for providers to integrate into their workflow, and designed for use among the sickest and most difficult to reach patients. Our telemedicine system allows patients to monitor progress remotely, triage appropriately, and intervene in care only when necessary. Despite the magnitude of this problem, no appropriate solution has been brought to market. However, the time has now come when patients and providers can use the Pedecare technology to take back control of their disease. How many foot ulcers can we prevent? How many hospital bills can we lower? How many limbs can we save by bringing this new technology to the patients who need it most? The time is now to make the Pedecare vision a reality. The time is now to take a step forward for your feet, for your health.